This is going to be a presentation on creating recommendations using the grade methodology. When we're looking at general definitions, the strength of the recommendation is going to reflect the extent to which we can be confident that the desirable effects of an intervention outweigh the undesirable effects. This does have implications for both clinical and medical legal effects. When you're looking at making a recommendation, this is where we determine the strength of a recommendation and is separate and different from any rating of the quality of the evidence. That is done prior to recommendations being made. The primary rating determinants are going to be the overall quality of the evidence across the outcomes, as well as the balance between benefits and harms, as well as the burden. Going to look at the patient values and preferences in consideration for the resource considerations as well. When you're looking at grade, level of action, and strength, the format is used to create a strong recommendation. This title and recommendation is used when the desirable effects of anything that you're looking at clearly outweigh the undesirable effects or clearly do not. We recommend using the phraseology of we recommend or we recommend against as the terminology. When you're looking at weak recommendations, these are also called conditional recommendations. They're used when the trade-offs are less certain, either because of a low-quality evidence or when the available evidence suggests that the desirable and undesirable effects are closely balanced, or if you have patients' values and preferences that will vary widely, or you're uncertain, or lastly, the resources used involved may not be worth relation to the benefit achieved. Also, we recommend using the phrase here, we conditionally recommend when a weak recommendation is warranted. What will contribute to the strength of a recommendation? When we're looking at how to determine this, you look at the balance between the desirable and the undesirable effects, taking both into equal consideration. You also look at the quality of the evidence. What type of research has been done? Is it a large center, multi-center trial, random control trial, or is it case studies? These will have variances as far as which ones become stronger in the evidence once it's reviewed. Uncertainty or variability in the values and the preferences, or if there's uncertainty about whether the intervention represents a wise use of resources. Each of these should be considered when you're looking at the evidence. Implications for recommendations. The implication of a strong recommendation include the stakeholders of the patients, the clinicians, as well as the policymakers. Each one of these must be considered when you're determining which recommendation to make. The weak recommendations also have the same stakeholders, the patients, the clinicians, and the policymakers. When you're looking at an evidence profile, once the choice of the strength of the recommendation is made, the rationale for the choice should be explained in what is known as evidence to decision tables. Briefly reviewing, an evidence to decision table must include key background information, criteria for making a decision, and what conclusions were drawn. The background includes details of the question, the PICO, being asked by the framework, as well as a summary of the information that the panel or others need to know in order to understand the question and why a recommendation or a decision is actually needed. Criteria that we look at includes the things such as judgments, research evidence, and additional consideration. These factors should be considered for making the decision once the evidence to decision table has been developed. Key action statements. Key action statements are the statements that are used in the writing of the practice management guideline. The components should always include the who, what, whom, under what circumstances, how, and why. These are more for clarity and understanding of the practice management guidelines. Also, a key description or prescription of specific behavior, well defined, and these are not statements of fact. When you're looking at making recommendations, some of the tips to think about is for strong, you want to use things and terminologies like should or recommend, so the clarity is there and there's no ambiguity. For weak recommendations, you could use the phraseology of may or conditionally recommend. Once again, it's about the clarity and understanding what it is that you're trying to present. Displaying the recommendations. When you're looking at displaying a recommendation, grade offers a preferred symbolic representation and a preferred number letter representation for the quality of the evidence and grades of recommendation. The quality of the evidence is rated as A for high quality, B for moderate, C for low quality, and D for very low quality. You also have the number representation, which includes strong recommendations for using an intervention given the number 1, weak recommendations for using an intervention given a number 2, You also could use weak recommendations against using an intervention as a number 2, or a strong recommendation against using an intervention as a number 1. When you're using this format, once again, it's recommended that you use terminology of we recommend or we recommend against. If it is a weak recommendation, it's preferred to use we conditionally recommend or we conditionally recommend against. When you get down to creating the recommendations, it is a process along with the remaining components of the grade format. When determining the recommendations, it's important to follow guidelines and apply the information that you've learned systematically across all of the evidence that you're reviewing.